Dr. Pramod Mittal and his team has given me a second life. And one thing good about this hospital, these people are not at all commercial. They are trying to do treatment for humanity.
Alchemist Hospital पेशेंट्स को इंटरनेशनल स्टैंडर्ड की कार्डियक केयर प्रोवाइड करता है, जिसमें Alchemist Advanced Heart Command Center with latest monitoring systems, latest and advanced cardiac cath lab, dedicated cardiac OT with state-of-the-art heart and lung machines भी शामिल हैं।
My husband and I went to a party, a reception party. There when we parked the vehicle, so he said he is not feeling well, breathlessness जैसे वो पहले बोलते। After entering in the place, really started coughing very badly, so badly that I felt कि अभी vomiting हो जाएगी।
No pain in the limbs, arms, anywhere, in either part of body. Only thing was सांस उखड़ रहा था. I was out of breath. Nothing beyond that.
Mr. Anand had lot of problems because he had suffered an acute insult to his myocardium because he had a heart attack with lung congestion, which was making him difficult to breathe, and his heart functions were also deteriorating. Normally they are around 55% to 60%, which had deteriorated to around 20 to 25%. That was one. Secondly, the challenge was because he is very obese for his age, height and the weight, because he weighs almost 120 kg. So these were the challenges because having an acute insult plus obesity, they portend a high risk for surgery. But since his condition was such, he had no other choice but to have a heart operation, and this was the reason, with calculated risk, we took him up for surgery. And during surgery we found his heart to be very edematous and very angry looking, which in normal circumstances after 6-7 days of wait the edema subsides, but in his case the edema didn't subside, it persisted. His heart functions were not adequate. So that was the challenge, that how to graft him and put him back on his feet. So luckily we were able to succeed, putting him on 2 arterial grafts along with 1 venous graft, and we were able to bail him out of the operation theatre. Second challenge was how to rehabilitate him.
We operated on him on the beating heart, and after putting the initial graft on the LAD, we took a decision that we will let the heart be for some time, and let the heart be for some time, which we did. We did not touch the heart for the next half an hour to 45 minutes, and it gave us the breathing space, in the sense the contractility of the heart increased, the edema subsided, and we were then given that grace period in which we could put the grafts on the lateral side of the heart. We were not able to do so on the right side because his coronaries did not allow. They were pretty much in a pretty bad state. The next challenge, as when we had shifted him out, was to get him off the ventilator as soon as possible because of his weight. And we were able to do so the next day in the morning. The next challenge was now to get him on his feet, and here my team of physiotherapists, my colleagues, Sir Dr. Mittal, Vikas, Dr. Gagan, and as Mr. Anand has said, my team of able intensivists, Dr. Ashish Mahapatra and Dr. Beauty and Dr. Rajneek, all of us, we made him sit up, do physiotherapy. And yes, Mr. Anand had the willpower. Today you see him walking and discharged on the 8th day.
Surgery went very well and everything absolutely, you can see my husband is in front of you. All the sisters are really angels. They literally take care of the patient like a real small baby. All the doctors are always available, no problem at all.